So a client with B negative blood require a blood transfusion during the surgical operation. If no B negative blood is available, the client should transfer with what? So my patient has a B negative blood. Is the blood group. But unfortunately, B negative blood is not available. No. So what are the alternative? A positive blood, A positive blood, B positive blood, O negative blood, and AB negative blood. So the correct answer is C, right? O negative blood. So why number C is the answer? So if the client own blood type and RH are not available, the safest transfusion is O negative. Let me recap it. If the client own blood type and RH are not available, the safest transfusion is O negative blood. So answer A, answer B, and answer D are incorrect because they can cause reaction that can probe the fatal to the client. Fatal to the client. Next, the nurse note that a post-operative client's respirations have dropped from 14 to 6 beats per minute. So 6 beats per minute is not normal. The nurse admin the naloxone or Narcan per standing order. Following administration of medication, the nurse should access the client for what? Pupillary changes, projectile vomiting. Number C, wheezing respiration. Number D, sudden intense pain. My question is, I prescribe or I give my patient the naloxone, right, or Narcan. So if we give it to them, what we could monitor or what should access the patient assessment. So now basically what we could do, number D's, right? We have to go for assess this. Sudden and intense pain. So Narcan, this is the Narcan, is a narcotic antagonist that blocks the effect of the client pain medication. Therefore, the client will experience sudden and instant pain. So we have to monitor. Let me recap it. I said when we prescribe Narcan or naloxone, Narcan is a narcotic antagonist that blocks the effect of client's pain medication. Therefore, the client will experience sudden, intense pain. So number A, B, and C do not related to the client condition and administration of Narcan. It is not related to. Therefore, they are incorrect. Next question here. A newborn body weight is 7 pounds at birth. At the 6th month of age, the infant could be expected to weigh how much? Very important for NCLEX board exam. 14 pound, 18 pound, 25 pound, and number D, 30 pound, right? So my newborn 7 pound today at birth, at the 6th month, it should be double, right? So correct answer is 14, number A, or 14 pound. So the infant birth weight should be double by the 6th month of age. So correct answer is number E. Answer number B, number C, or number D are incorrect because they are greater than expected body weight gained by 6 months of age. Next question. A client with non-topical sprue has an exacerbation of symptoms. Which meal selection is responsible for recurrent of the client's symptom? Acute exacerbation, right? So number A, toasted salad with oil and vinegar dressing, baked potato with a sour cream. Number C, cream of tomato soup and crackers. Number D, mixed fruits and yogurt. So which meal selection is responsible for the recurrent, right? So correct answer is number C, the cream tomato soup and crackers. Why? The symptom of non-tropical sprue, this is the keyword, my patient have it. So an acute exacerbation, as well as those of the celiac disease, are caused by ingestion or intake of gluten-containing food. Gluten. So gluten we found in wheat, oat, barley, or rye. So you see crackers. So creamed soup and creamy soup, whatever tomato does not matter, cracker, as well as some cold card contain the gluten. So answer A, answer B, answer D do not contain the gluten. Toasted salad, well, vinegar do not contain gluten. Potato, right, do not contain gluten. Mixed fruits and yogurt, so not contain gluten, therefore they are incorrect. Next question. A client with congestive heart failure has been receiving digoxin or lanoxin. Which findings indicate that the medication is having a desired effect? Number A, increase urinary output. Number B, stabilized weight. Number C, improved appetite. Number D, increase the pedal edema. So correct answer is increase the urinary output, right? Which finding indicate that medication having a desired effect? Increase the urinary output. Because lenoxin or digoxin shows an strengthening the contraction of heart and increase the urine output so that the medication is having a desired effect by eliminating excess fluid from the body. So answer B is incorrect because the body weight would decrease, not stabilize, when too much fluid came out from the body. Answer C is not related to the digoxin, improve appetite. Therefore, it is incorrect. Answer D is incorrect because pedal edema would decrease, not increase. Which play activity is the best suited to the gross motor skill of the older? So number A, coloring book and crayon. Number B, ball. Number C, building cubes. And number D, swing set. So correct answer is number B, means ball. So why it is? The shoulder has gross motor skill suited to playing with a ball, basketball, soccer ball, so which can be kicked forward and throw overhead. So it is motor. It indicates the motor skill. When you throw the ball, kick the ball, indicate the motor skill. Motor means muscle. So answer A or answer C is incorrect because they require the fine motor skill. Building cues, building blocks, coloring the books, you need the fine motor skill, not a gross motor skill. So answer D is incorrect because the shoulder lacked the gross motor skill for play on the swing test set. So 29. Next question. A client in a labor admit to using alcohol throughout the pregnancy. The most recent use was the day before. Based on the client history, the nurse should give the priority to assessing the newborn for what? Number A, respiratory depression. Number B, wide set eye. Number C, jitterness. And number D, low set ear. So the nurse should give the priority to assessment the newborn for the correct answer is number C. So it is the correct answer, right? So why number C is the correct answer? Because the jitterness or irritabilities are the sign of alcohol withdrawal in the newborn. So irritability, restlessness, jitterness are the sign of alcohol withdrawal. So answer number A is incorrect because it would be associated with use more recent than 1 day ago. Answer B or answer D are the characteristics of the newborn with the fetal alcohol syndrome, wide set eye, low set ear. But they are not the priority at this time. Therefore, they are not answer. Next question here. The physician has ordered aluminum carbonate gel, right? This is the medication ordered for a client with a recurrent indigestion. The nurse should test the client common side effect of medication, which include constipation, urinary retention, diarrhea, and confusion. So what are the common sign symptoms if we prescribe or if you use the aluminum carbonate gel? The correct answer is it can cause constipation. So antacid containing aluminum tends to cause constipation. So answer B, answer C, or D are common side effect of and not the common side effect of aluminum carbonate gel. So answer A is correct. A client is admitted with suspected abdominal aortic aneurysm, shortly called AAA, right? 3A's. Abdomen aortic aneurysm. Abnormal weakness of the wall of the aorta, chance of tearing, and this is a life-threatening condition. A common complaint of the client with a abdominal aortic aneurysm is loss of sensation in the lower extremity. Number B, back pain that lessen than standing. Decrease the urinary output. Number D, pulsations in periumbilical area. So correct answer is the pulsations in periumbilical area. So the client with a abdominal aortic aneurysm frequently complain of pulsations or feelings of the heartbeat in the abdomen, pulsations in the periumbilical area. But your pulsation should be more in left upper chest where the heart is located. So answer number A or answer number C are incorrect because they are not associated with abdominal aortic aneurysm. Answer B is incorrect because back pain is not affected by change in position, right? Next here, the nurse is caring for a client hospitalized with a nephrotic syndrome. Based on the client treatment, the nurse should do what? Number A, limit the number of visitors. Number B, provide a low protein diet. Number C, decrease the possibility of dialysis. Number D, offer the client additional fluid. So correct answer is limit the number of visitors. So the nurse is caring for a client hospitalized nephrotic syndrome. This is my diagnosis. Because of client treatment, the nurse should limit the number of visitors. Why? The client with nephrotic syndrome will be treated with immunosuppressive drugs. So limited visitors will decrease the chance of infection, and prevent infection is the most priorities. So answer B is incorrect because the client need additional protein. Answer C is incorrect because dialysis is not indicated for the client with a nephrotic syndrome. Answer D is incorrect because additional fluid are not needed until the client begin diuresis. Next question. A client is admitted with acute adrenal crisis, right? This is the keyword. My patient has a acute adrenal crisis. During the intake assessment, the nurse can expect the fluid that the client has: a low blood pressure, number B, a slow, regular pulse, number C, warm or flushed skin, number D, increased urination. So correct answer, low blood pressure is a correct answer, right? So why low blood pressure? So the client with acute adrenal crisis has a symptom of hypovolemia and shock. Therefore, the blood pressure would be low. So answer B is not correct because the pulse would be rapid and irregular. Number C is not an answer because the skin would be cool and pale. Cold, not warm. Number D is not answer because the urinary output would be decrease, not increase. Next question here, a 5-month-old infant is admitted to the ER emergency with a temperature 103.6 Fahrenheit and irritability. So patient has a fever. The mother stated that the client has been listless for past several hours and also that he had a seizure, means involuntary movement of muscle on the way to the hospital. The lumbar puncture confirms a diagnosis of bacterial meningitis, means inflammation of the meninges. The nurse should assess the infant for what? A periorbital edema. Number B, the tenseness of the anterior frontanel. Number C, positive Babinski's reflex. Number D, negative calf sign. So the correct answer is the number B, right? The tenseness of the anterior frontanelis. So the why number B is correct? Because tenseness of the anterior frontanelli increase the intracranial pressure. Patient has a bacterial meningitis and intracranial pressure is supposed to increase. So anterior frontanelli will be tense. So the answer A is incorrect because periorbital edema is not associated with meningitis. Answer C is incorrect because positive Babinski reflex is normal in the infant, only 5 months old. Number D is incorrect because it is related to the preterm infant, not to the infant with meningitis. So number B is an answer. Next question here, a client with AIDS, right? Acquired immunodeficiency syndrome, admitted with the diagnosis of the pneumocystis carinii, pneumonia. So patient diagnosis pneumonia, organism name is pneumocystis. Shortly after his admission, he becomes confused and disoriented. And he attempts to pull out his IV, means restlessness, or refuse to wear a oxygen mask. Based upon his mental status, the priority of nursing diagnosis is number A, social isolation, risks for injury. Number C, ineffective coping, and number C, ineffective coping, and number D, anxiety. The correct answer is number B, the risks of injury. So injury prevention is the most priorities for this patient. So the client priority of nursing diagnosis is based on his risks for self-injuries. So answer A or C and D focus on the client's psychosocial need, which do not make the priority over physiological needs. Therefore, they are not an answer. Risks of the injury is the priority here.